Hello everyone, welcome to The Social Doctor, and this is Dr. Ayushi. The Social Doctor is a platform for the doctors by the doctors, where we are on a mission to help each and every doctor with his or her career growth. And we do that by discussing journeys, experiences, and knowledge from successful medical practitioners. And today we have Dr. Priyanka Pipara with us, who is here to discuss about her journey, her struggles, and what did she understand about the opportunities and the struggles a female gynecologist faces while settling down. Gynecology, considered to be a female oriented branch, also has a lot of challenges attached to it. And hence, we are here to speak about it, to discuss about it, and to get a better understanding so that all the upcoming postgraduates can actually understand and how to get over all these challenges and to help them to get a better future. Welcome, Dr. Priyanka, to the platform. It's really nice to have you here.
Thank you so much. Thank you. It's my pleasure.
Yes. So let's understand, how did your journey start and how did you, from the starting till now?
Yes, I did my MBBS from RNT Medical College, Udaipur. And then after that, I did DGO from Maulana Azad Medical College, New Delhi. And then I went for DNB to Jaipur. And later on, I did my senior residency from Christian Medical College, Vellore. Then I came to Calcutta and started practicing.
Okay. Great. So now, as you mentioned that you, after your, DNB also, you did your DNB. So what is there is a lot of confusion of a degree course and a diploma courses.
Yes.
If you can, help us understand the difference between the same and why did you go for this, your understanding for that can help the current people to decide on.
Yeah, I think one big mistake which I did is I took diploma because when I was in counseling, I was getting both DGO and DNB, but I preferred, I think, place than the degree because I think the place was near to my hometown. But I say all the postgraduates who are getting both degree and diploma, so better to prefer degree. Although lot of people are taking degree, but sometimes because of some reasons like okay, we can do DGO from a better place and something we think like that I think did, and we choose to do a DGO. Like a diploma course, but I suggest if you are getting both the things, better to choose a degree. That's one thing. If you are not getting a degree course and you're getting a diploma, then choice is yours, like what you want to do further. Whether if you want to continue with the diploma, that's fine, but later on you might need to do a DNB course or a MD course. Or otherwise, if you want to settle down in a small city or a town and you are having your own setup, then it might not have much difference. But later on, you might realize, like I realized when I was doing DAGO, I realized I think we need to do a degree. So that was a big mistake. So I suggest all the postgraduates to think before taking anything about this.
Great. So thank you for clearing that out. So now, what do you think as a fresh graduate when you just passed out? What do you think, what are the kind of skills that every gynecologist, a fresh passed out postgraduate gynecologist should know before settling down? Some kind of skills that they need to learn before settling down. If you can elaborate on those.
Yes, definitely. After finishing your post-graduation, you need to decide what you want to do in life. Like there are also some further branches in gynae also after doing post-graduation. Like if you want to do something in infertility or in fetal medicine or in gynae. These are the three branches which are there. So if you want to go for that, definitely you can do any fellowship or any what sort of FNB courses are also available that you can do. For me, I think I didn't want to do all these three things. I was more interested in general obstetrics and gynae, and definitely it comes with the laparoscopic surgery also. So if you want to do general obs and gynae practice, I suggest all the postgraduates to just go for at least 2 to 3 years of senior residency in any high volume center, like in a government setup or in a private, but it should be in a high volume center where you're working so much, you're tackling down a lot of patients and you're seeing all the different kind of complications and all. In that way, you will achieve confidence and that will definitely help in your practice. So before directly going and joining any corporate setup or anything, definitely do at least 2 to 3 years of senior residency. That is for general obs and gynae practice.
Hmm.
With that, I say if you are practicing general, definitely you have to do minimum some laparoscopic surgeries.
Hmm.
With that, again, there is a problem with the learning, because during post graduation you don't learn much about laparoscopy or the minimal access surgeries. So there are again two ways how you can go about that. Either you can go again for the training. There are a lot of training institutes available. You can go for 6 months or 1 year training, or you can learn on job. Like I did it or learned on my job. I was attached to some seniors. I learned from them, and with that you can join some charity institute or a government institute where you get cases to operate. Because initially, when you are in practice, getting gynae patient is really difficult, because you can get obs patients, obstetric patients, but getting gynae patient is difficult. So you have to join some small institute or a charitable institute so that you can practice. But one thing I will tell to all postgraduates, even if you are learning, one thing is, remember, do not harm your patients.
Hmm.
That is okay.
Correct, correct. That's correctly said. So now when you mention about, learning, obviously one in your job and then in the training, 6 months and 1 year trainings. And then there are short trainings also, workshop kinds, a
Yes,
week
yes,
or
yes.
so what do you suggest in that? What is your point of view in that? If somebody wants to go for training, should they go for longer trainings, or they can go for shorter ones? That also helps. What is your suggestion on that?
I think the longer trainings are better. Means the thing is, if you want to learn laparoscopy, it's not a very small thing. So if you
Hmm.
want to learn laparoscopy properly,
Hmm.
at least to go for at least 6 months training. Although I didn't go for any training because I learned on my job. Since I joined, means I am practicing, I'm doing laparoscopy with my seniors or with myself. It's like that. So
Hmm.
either you learn on your job, and if you're going for training, definitely minimum for 6 months training, so you will have a great idea. And at least the general gynae surgeries, what do you call, like simple ectopic pregnancy and ovarian cystectomy, hysterectomy,
Hmm.
uh, all these things, if you will be able to manage. I am not telling you that you need to learn hi-fi laparoscopic surgeries. For that you have to again go for the longer training. That is not required for general practice, definitely, but the minimum these things you should know.
Hmm. 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 So now, as our topic is understanding what are the kind of struggles a female, although being a female oriented branch, but still there are kind of struggles that a female gynecologist faces while settling down. If you can elaborate on those, what are the kind of opportunities that you think a female gynecologist has? And then obviously the other side, what are the kind of struggles and how did you overcome those?
Yes, of course. About the opportunities, we say that the gynae is a female-centric branch. Definitely it is. Especially in obstetrics, female prefer to come to
Yes.
female gynecologists.
Yes.
That is the advantage for females, and that's what
Yes.
the males are having some problem with that. Definitely,
Yes.
I agree. Okay, I completely agree. But same time, females are having other challenges also,
Right.
because when you finish your post graduation or you are doing post graduation, at the same time you're getting married and you're getting pregnant, you're having kids and all. But it's the same time. And I think that is also really important in your life, because the personal life goes with the professional life.
Correct. Correct.
So that definitely comes in, and in that way, because that time you want to learn also. With that, you're having family, you're having kids, and so you have to adjust with all these things. Like in my case, when I finished post graduation, my husband went for fellowship in Vellore, and at the same time I got pregnant, I delivered. So in Vellore it was quite hectic, so I really could not join any job there.
Hmm.
And it was almost, I think, 2 years break after the post graduation. So when I finished, when I joined after 2 years, I thought I was totally blank. Means I was out of touch of my subject for at least 2 years.
Correct.
So I was really a little bit frustrated, and so I was thinking what to do now next.
Hmm.
But I think you get something. You get something. So I joined senior residency there in Christian Medical College,
Hmm.
and slowly I started picking up. And later on, I learned a lot of things there, especially obstetrics. So
Hmm.
that's what I'm telling you. You
Hmm.
will get your path. That's not a problem, but you have to have patience for that.
Hmm. Hmm. Hmm.
So don't delay. I mean, some females I see, oh, we will not have kids now, and don't think like that. I mean, something you will get later on. So don't worry
Yes,
for that.
yes, yes. No, that's very positive. Things definitely fall in place, but taking decisions at right time is important. Yes.
Yeah, one more thing, like I will say, like if you want to go for training, for any training, like even for laparoscopic or any super specialized courses, you
Hmm.
have to go out and you have to leave your family or you have to leave your kids. So how feasible for a female is it? That you need to understand. Like for some it's possible, you're having family support and all. Sometimes it's difficult to leave child, especially when you're so much attached and you cannot leave a child for even for 1 or 2 days. Like for me, I really could not leave my child for any training or anything. So I decided I learn on job and I will not go for any training. So
Hmm.
it's more for the females than males, what I
Yes.
think.
Yes. No, no, definitely. See, I completely agree. The family responsibilities is one very important part of every female's job. That's true. And yes, you have done so well. So I'm sure every female gynecologist who goes through this journey can actually get inspired by you and do it themselves as well. So now, as you mentioned before, that you have settled down in Kolkata. Kolkata is a metro.
Yes, yes.
So, and you know, metros have a different challenges of settling down as a doctor. So, what are the kind of challenges that you faced, and how did you make your space there?
Yes, I will say starting practice in a metro city is it's a big challenge. It's really a big challenge because when you are in a metro city already, there are a lot of big shot gynecologists around, and the place is already saturated because everybody wants to settle in a big city. That is
Correct.
always there.
Correct.
So of course that was a big challenge for me, and I will suggest all the postgraduates to decide what you want to do in life. That is very much important. Like if you want to settle down early or you want to earn money early, definitely go for a small place, a small, like I say, a small city or a town, where you can have your own setup or you can join a small setup and can start early.
Hmm.
But if you go in a metro city, definitely you have to have patience. And I mean, joining corporate setup is really difficult. I mean, nobody will allow you to enter in the corporate setup immediately after post graduation. So it was a big challenge for me. But I think slowly, you start developing and acquire skills. That one thing I will tell you: acquire your skills, and when you're free that time, do something else because there are a lot of things to do around. So do something else, acquire skills, and that will definitely come out. You will come out with that.
Hmm, 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 hmm. Great, great.
That was
That is so. So what you suggest if somebody wants, because you already mentioned that corporates do not help get allow you directly after post graduation. So if somebody wants to get settled in a metro, what should that person do just after post graduation? What are these steps that you will suggest for them?
yes. What you can do is like what I did is join small setups. Like I did join charity hospitals to learn. Because you have to be in touch with the subject. Your hand should work, and especially in surgical branches. So you
Yes.
keep on doing that thing, and with that, have your clinics, your own clinics. That like in Calcutta, the practice system is like that. You have your own clinics, and with that, you can get attached to different hospitals.
Correct.
Right from the beginning, I really didn't want my life to be very hectic. Like
Hmm.
it's totally your choice what you want to do. You want to be a busy practitioner, then you have to join some 10 clinics or some 10 hospitals.
Yes.
That way I really didn't want. And one good thing is, like, my husband is already settled, I have family support, so
Hmm.
financially that burden was not there for me. Matlab, that pressure was definitely not with me, so I
Correct.
could start slowly. So you choose what you want to do,
Hmm.
how you want to live your life. That is really important.
Hmm.
If you want a little bit cool life, you choose in that way. If you want, now I want to be a busy practitioner, a famous practitioner, or I want to earn more, then you have to definitely do extra for
Hmm.
that.
Hmm. Hmm.
That's the way.
So now when you mention, taking choices, if you do not want to get busy the whole day, so what are the kind of, you know, branches or subspecializations, or what are the kind of ways a gynecologist should opt to become a comparatively easy practitioner? Because gynae obs is a branch that can have, if you go into pure gynae obs, there are untimely calls, there are all kind of problems.
Yes.
So how do you manage, what are the kind of branches or specializations, or things that people should do who want to stay a bit easy?
Yes, it totally depends on your interest also. It's not just you choose the branch, and if you're not interested in that, no point of doing that. Means I suggest whatever you do, you should have interest in that thing. That is one important thing. Like we have infertility in gynae. Of course, it's comparatively a cool branch. Like you will not have night calls and you'll not have emergencies, but
Hmm.
definitely you should have interest in that. Like
Hmm.
I was initially, I thought I will do, but now when I practice and I get infertility patients, to be very clear, I really get depressed because the patients are all very depressed. They are coming and coming again and again and again, and they are not unless they get pregnant, they're not very happy and satisfied. So after 3-4 visits, they will go to another doctor. So I really don't like seeing infertility patients. That's one thing. So that depends on you what you want. Again, there is a fetal medicine. It's a very upcoming branch nowadays. A lot
Hmm.
of people are doing, like in Calcutta also, almost I think only 3-4 big fetal medicine specialists are there. So
Okay.
this is one good thing. If you are interested, you can go for that. Next thing comes the oncosurgery.
Hmm.
Gynae onc, I will tell those who really want to work hard, because the surgeries will be like 4, 5, 6 hour surgeries. So
Hmm.
if you want to do that, that is totally you. I am not interested. I really can't stand any surgery more than 2 to 3 hours. So
Yes.
I never choose that.
Yes, yes. So, but comparatively, oncosurgery is also, the surgeries go long, but there are no emergencies and no untimely.
Yes, yes, yes.
Hmm. Okay, that's nice to know. So,
One thing obstetrics I like about that is most of the patients, the good thing is most of the patients, they come happy.
yes,
They are coming to you for delivery, and after when they are going, they're happy.
yes,
Most of the patients, I'm not telling everybody, but
yes,
most of the
yes.
patients, that is one good thing about the obstetrics.
Correct. And that is the reason it was always considered to be a happy branch.
Yes,
One of
yes.
the big reasons. So, so apart from the super specializations, you have also, done MRDG. So
MRCOG.
MRCOG, sorry, MRCOG. So what are, and which is a UK degree.
Yes.
But is it that you plan to go to UK? What was the, your thought behind this?
Yes, after finishing, like during post graduation, you don't have much idea about MRCOG. Like when I came to Calcutta, I realized this degree is really great degree, and a lot of importance to this degree. Now, I say ki those who want to, it's not like you need to just go to UK to do this degree. That one thing, and what you want. Like for me, I did this degree because I just wanted to do this. That one thing. If you do this, you can go and settle down there. Or
Yeah.
the third thing is, if you can just want to go there, have some training there 2 to 3 years, and want to come back to your own country.
Mm,
Totally choice is yours what you want to do.
mm,
About MRCOG, good thing about recently is all the three parts are we can do it in India. So you need not to go to UK for
mm,
doing this degree. So you can save your money, you can save the time.
mm.
I did all my parts here in India, and I just went for convocation to UK, and that was great. So that's one thing. And I say you do this degree. The good thing, the outcome is uh, you have different type of confidence after doing this degree. With
Mm,
that, communication skills comes, because I think there is something lacking in our teaching in our India, our country.
mm,
So if that communication skills you develop, how do you deal with the patients, that is totally different after doing this degree. So I suggest, if you can do this degree, you should go for degree. Depends how much you want to read, or you can give time. Like initially when I came to Calcutta, I was not having that much practice, so I was comparatively free. So I thought, do something. That's
mm,
what I'm telling. If you're free, do something. So
mm.
I did this, and it takes time and it takes hard work, definitely.
So did it help you in your practice as well in Kolkata?
Yes. I say definitely. See, patient will not see your degrees. What I feel is patient will not see your degree.
Mm,
The thing is, patient will see how you're managing the patients, or how you're dealing with the patient. So
correct.
that's what I told. One thing, the communication skills you
Mm,
learn from while you're doing this degree.
mm, mm,
That
mm.
one thing. So not because of degree, it's what you are doing, what you're practicing during doing this degree, that will help you in long run.
Yes. That's nice to know.
And another thing is, if you want to go for training or some different things abroad, UK basically, uh, this degree will help.
Yes, degree. Yes, definitely. Because because it's from the Royal College, what I understand, right? Royal
Yes,
College.
and it's too much valuable. I think all over country except US, this is
This is
valid. This is valid.
okay. Great. So one more thing, currently with the pandemic, things have been really different. With students, have postgraduate who are into post graduation, 2 years have just went by. There's no exposure. Although they are working, but it's more for COVID, and things are not being learned the way it has to be learned. So what is your suggestion for them, how they can learn their skills and how they can get better so that they can be to the mark, to the standards of the society?
Yes, I know the obstetrics and gynae, which is a surgical branch, especially the surgical branches, where you need to do surgeries to learn surgeries, and lot you will do, lot you will learn. That's there, and it's really a bad situation. Like for the post graduation, especially those who are not doing surgeries, who are not getting patients to operate. That really difficult situation for that. But we can say, like, we cannot avoid this again. So you have to accept whatever is happening, and later on definitely you will get time to learn. So there is whole life, every day is a new learning day, so you will learn definitely. I say them, just have patience. That is the only thing which is required at present.
Yes, correctly said. So anything else that you will suggest for the current postgraduate, any motivational quote for them, ending on a high note, something for them that motivates them to stay positive, especially in this time, and to pursue this branch?
Yes, one thing I will tell you: just do whatever you want to do. I mean, you choose what you want to do. Don't You can take advices from the people around you, but I think you choose what you want to do, so that you will not have regrets. Ki, why I have done this, I would have done this. So that one thing, have passion for that. Whatever you are doing, have passion and dedication. That is really important. Third thing is hard work, which is actually needed in each and every profession. So that one thing. And one extra thing which is needed in, especially in medicine, is patience. So have patience. You will definitely have patience. Don't worry for that. And last but not the least, have honesty. Honesty, which is really, really required in day-to-day practice. I suggest all the postgraduates, don't do anything which you think is wrong, because that will pay you in long run. And I think you will be happy and you will be satisfied at the end of the day if you will be honest. That is really required.
That's These are some points that are so important, and I believe we are always taught throughout our life. It's just that at some points of your work or your life, you just slip at times. But yes, imbibing them again and again help you to understand that you have to walk on this path. Thank you so much, Dr. Priyanka. It was so nice understanding your journey, understanding how did you get over all your struggles, as well as what are the small niches about the gynae as a practice, how to set up, how to get into different specialization. It was really nice to know. Thank you so much.
Thank you so much. It's my pleasure. Thank you.
Yes, thank you so much everyone for joining us at this time. I'm sure it would have helped you. Do share with all your friends and colleagues who want to pursue gynae as a branch or are there doing their post graduations. I'm sure this will help them to stay motivated, to be on track, as well as understand how to establish themselves after their post graduation. Also, do follow us on our Instagram and YouTube channels. There you can find all our old videos, which can also help you in your career growth in different ways. Thank you so much, everyone. Thank you so much, Dr. Priyanka, for joining us.
Bye-bye. Thank you, Dr.
Have a good day.
Thank you.
Bye-bye.
Thank you. Bye-bye. Bye.